So let's continue with our medical cannabis journey. Previously, what we did was we talked about how to get started with medical cannabis, how to get a medical marijuana card, how to visit your doctor. We also talked about navigating medical cannabis, very specifically talking about the terminology that you need to be able to identify products and services in the medical cannabis world. And then also we talked about routes of administration, which are the methods of using medical cannabis, both the product's types, the duration, the onset, and terpene content. Now, in this particular video, what we're going to talk about is how to craft your individual cannabis treatment plan. Very specifically, your endocannabinoid system, the terpenes that you'll need to identify your terpene toolbox, or the toolbox that you'll need to address your particular medical condition, understanding how to read and what a certificate of analysis is, and finding your therapeutic dosing level using journaling and self-guided dosing techniques. So let's identify the main components of cannabis. These are cannabinoids, terpenes, and flavonoids. Think of cannabinoids like Legos. Your receptors in your body have different shapes. And what the cannabinoids do is they bond to those receptors, which allows you to be able to introduce the terpenes, or the medical healing properties of cannabis, as well as flavonoids. And then by being able to have this bonding process and also this medical transference process going on, this is called the entourage effect. What that means is that all three of these components working together are more effective than they work individually. And it really allows you can really feel it when you start using cannabis, because what you'll do is you'll feel actually a lot better, and you'll identify the healing properties that you'll see in cannabis itself. The main cannabinoids that we run into are THC and CBD. THC is known for providing that psychotropic effect, or that psychological effect, aka getting high. But in reality, what THC is it binds to the receptors that are in your brain and also that are in your spinal system. It really affects a lot of the control mechanisms that your body has, what are called the CB1 receptors. And so very specifically what it's doing is it's helping to control the level of activity of your neurotransmitters, and that's a nice way of saying it helps to control pain. THC is very important to being able to manage the pain levels in your body. Now, CBD does not have psychological or psychotropic effects. It allows you to be able to address a lot of the white blood cells. Also, it works with your tonsils, it works in your spleen, and what it's doing is it's helping to control the inflammation that's in your body, as well as a lot of the way your immune system functions. So both of these are really, think of them like super vitamins that are really helping you manage your particular body. Now, why is this important? Well, because our body has a nervous system. We've known about this when we started growing up. You hurt your finger, you hurt your knee, a signal is sent to your brain that says, Houston, we have a problem. Now, what's fascinating is for years we started studying what was really happening, and this is where a lot of the pharma drugs came into play. And what we found out when we started studying medical cannabis in 1960s and the 70s was we have an endocannabinoid system. This particular system is a series of receptors, CB1 and CB2 receptors, that are in our brain, spleen, our nervous system, our white blood cells. And what it does is it helps to control our memory, our emotions, our appetite, sleep, pain, inflammation, and immune response. It's very, very interesting that for years we've always tried to figure out how the nervous system handled and managed your body. Now we know exactly how that happens, and that's with the endocannabinoid system. It's opened up a whole new world of treatment, medical treatments for your body. Now, what's interesting is the CB1 and CB2 receptors do identify and work with, again, the brain, the spleen, nervous systems, the blood cells, and your immune system. But also what's interesting is that the CBD also works with a number of other receptors. These are the serotonin receptors, HT1s, the inflammation and circulatory receptors, added 2A2s, the VR1 receptors, which control pain and your body temperature, and also the GRP55 blood pressure. So cannabis has a lot to do with how your body manages both anxiety, pain, memory. It's really the controlling mechanism of your body, and by being able to put your body in balance, that's referred to as homeostasis, which is what the objective is going on. Why cannabis is such a big deal? Well, because our body uses those endocannabinoids, which we talked about, to control itself and manage your body functions. What do the phytocannabinoids do? What are the plant-produced phytocannabinoids do? Well, they exactly mimic your endocannabinoid. And what's interesting is when they're introduced into your body, it provides more healing properties to your body to be able to manage itself and provide the body functions that you need. More specifically, your endocannabinoids are stored in your fatty acids. When phytocannabinoids or cannabis is introduced into your body, that's also stored in your fatty acids. When your body sees you have a problem, Houston, we have a problem, It then produces the endocannabinoids it needs, both from the endocannabinoids and for the phytocannabinoids, and sends that to that part of your body, whether it's your knee pain, finger, your digestive system, to be able to really put your body back into homeostasis. This is a very important process, and especially as we get older. I'm a senior citizen. I don't produce the endocannabinoids like I did before. So having my body being able to have access to the phytocannabinoids really helps it quite a bit to be able to not only manage itself, but also stay in a very healthy homeostasis state. We talked about those cannabinoids, which are like our Legos. They have different shapes and they bond to our receptors. But what are they bonding? What are they doing? They're introducing terpenes and flavonoids. Very specifically, terpenes give you the medical value of cannabis. Here's a couple of them very quickly. Pinene, for example, which helps with stress and anxiety. It's an analgesic, it's a bronchial dilator, and it helps with short-term memory. Linalool, which is great for elevating your mood, again, stress and anxiety. Great for sedatives, to relax you and being able to also help you fall asleep. And also it's an antifungal and also an analgesic. Myrcene, which is very common and found in almost every cannabis plant that's out there, is very good for, again, anti-inflammatory, antibiotic. It's also a sedative and a muscle relaxant. So we know that each of these terpenes has a particular terpene profile. Now I'm going to show you a chart. I don't plan to go through this in depth. What I will do is provide a link in the video down below so you can actually access this chart and look at it, as well as if you're looking at this from a webinar standpoint, it'll be in the emails that are sent out to you. But the importance of this is that we know that there are a number of different terpenes. There's 200 of them that are identified. These are the main terpenes that we know about. We know there are different symptoms and conditions, and by being able to map which of the terpenes help with different conditions, it tells us which terpenes we should use to identify, or should be identified for your particular medical condition. So let's be very specific about what we're talking about. When we talk about stress and anxiety, we know that linalool, limonene, myrcene, and beta-caryophyllene do a great job of being able to address stress and anxiety. Also, it helps with PTS, insomnia, chronic pain, and depression. So we know that these particular terpenes will help with this particular condition. Similarly, if we're looking at pain management, here's a number of terpenes that can help with pain management, whether it's pain relieving or anti-inflammatory. We know that those particular terpenes will help with those particular conditions. So your question might be, how do I find these particular terpenes? I'll show you that in a minute, but I do want to point out next week what we're going to be doing is we're going to be taking almost all of the major conditions that people use medical cannabis to address, and we're going to actually break them down into charts like this so you can identify many, many more conditions and which terpenes you should be using. But let's be very specific with respect to what they call certificates of analysis, referred to as COAs. COAs tell you the amount of terpenes that are in the product. This is an example of a COA from a company called Air, and it's a vape pen, or it's a vape cartridge, I should say. And here's the terpene content for it. I can identify, for example, I'm looking for beta-caryophyllene, and also which helps me with my particular pain management problem, and also myrcene. I know this product has this particular terpene profile. Here's the potency of each of the different cannabinoids that are there. And also notice that these little dots that are here, it tells you if it's been tested for mold, pesticides. It tells you how pure the product is. This is very, very key. Not only does it tell you what you need to identify your particular condition, but it also tells you how clean the product is. And this is very, very important because a lot of the street cannabis that you buy hasn't been tested for molds, pesticides, and things like that. So I recommend only using cannabis products that you can see the COA and you can identify that the COA has the components, specifically the terpenes and the cannabinoids you need for your particular medical condition. Now, let's jump into why this is important. Well, we talked earlier about terpenes, but what we didn't talk about was the fact that all terpenes have a heat level. In other words, at certain points, the actual terpene is produced, and at certain heat levels, it's actually burnt off. So in my particular case, I have herniated discs in my neck. What I'm looking for is something that'll help me with pain and help me with inflammation. So notice that right in here, at this range here, we have beta-caryophyllene, we have linalool, we have limonene. A lot of the products that I'm looking for, terpenoline, will help me with my particular condition. So if I have a vape pen, and I can set that vape pen at, let's say, between 350 and 400, let's say 390, I can bring out the best of these particular terpenes and being able to address my particular condition. If I'm looking for other terpenes, I can either lower the heat or increase the heat, depending on how I want to dial in that terpene profile. This is very, very key. And one of the reasons why I recommend using vape pens as opposed to smoking joints, because by being able to use a vape pen that allows you to control that temperature, you're really homing in on the medical value of the particular product that you're picking up and how to get the maximum benefits from medical cannabis. So let's talk a little bit about how we find our therapeutic dosing level. Well, everyone wants to start using cannabis using different routes of administration or methods of taking cannabis. I recommend by starting with tincture drops, because with tincture drops, you can go low and go slow, meaning you can take a quarter of an eyedropper for a day or two, find out how you feel. If you're not getting any relief, increase the amount that you're using. Let's say you go from a quarter of an eyedropper to a half an eyedropper. Try that for a day or two, see the results that you get, then increase that to maybe 3/4 of an eyedropper for a day or two, maybe going up to a whole eyedropper, depending on your body. What's really, really key to understand is two things. Cannabis is what they call biphasic. What that means is while you're under your therapeutic dosing level, while you're increasing that, you'll feel relief from medical cannabis. But if you start taking too much, once you reach your therapeutic dosing level, you start taking too much, you'll actually be getting a lot of the negative side effects, meaning a lot of the conditions that you're trying to address may start coming back, and you may get that heady or stoned feeling that's there. That's when you have too much, and that's when you got to back down. So if you're using, let's say, 3/4 of an eyedropper of a tincture drop, go down back to a half an eyedropper, and it'll be able to, by adjusting that down, you'll find your therapeutic dosing level for THC. You'll know you're sensitive to 5 milligrams or 3 milligrams or 2 milligrams of THC, which is really, really important, because once you understand that, then you can increase the amount of CBD. Again, we talked about ratioed products, having a higher CBD to THC ratio to see if that helps you with not only your inflammation, but a lot of the other bodily functions that I talked about earlier. Now, the second thing to understand about cannabis and dosing is that every person's body is different. Just like alcohol, just like caffeine, people have different tolerance levels to cannabis. I have friends of mine, for example, who can drink one drink and they're done for the night. I have other friends of mine that can drink the whole bottle and they're just getting started. It's the same thing with cannabis. There are people that have a high tolerance to THC, and there are people that have almost no tolerance to THC. My wife, for example, is not very tolerant to THC. So she uses a high ratioed, meaning a high CBD to THC ratioed product. In my particular case, I'm sensitive. I actually can handle THC pretty well. And because of the pain levels, I've gone the other way. I use a 1 CBD to 4 THC to be able to address the herniated discs in my neck, which sometimes can get to be pretty heady. They can get up to a pain level of a 7. So really what you're doing is you're trying to figure out for you what your dosing level is. It's not something that your doctor can really tell you. Now, one of the nice parts about cannabis is you're in control. So as you're titrating, meaning as you're slowly raising that dosing level, and by the way, if you're using a gummy or a brownie, cut it in half. Start there. Start by using less than what you think, and start low and go slow, because what you're going to do is you're going to track how that affects you. What are you going to track? Very specifically, the product and the dose, the dose, how long it took to affect, the duration of the effects, and any notes. Did you feel any relief? Did you not feel any relief that's there? Let me give you a prime example of how this works, and worked very effectively for me. I had a left knee replacement. My concern was pain. I was working on pain management. One night, I was using a combination of THC and CBD, and one night I ran out of THC product. And with knee replacements, I was very concerned about my pain level. So what I did was I increased the amount of CBD. That's all I really could do. I was out of THC. And what I found out is my pain level went down. And consulting my doctor the next day, what I found out was what happened was by increasing my CBD level, I was reducing the amount of inflammation, and my pain was coming from the inflammation. So what I was able to learn by journaling was I needed a higher ratio of CBD to THC to address my particular pain issue, not the other way around. And like I mentioned, I do use a higher ratio of THC to CBD today because, again, when I wake up in the morning, I do have a high level of pain level in my neck. And it's important that I control that not only then. So this is very, very important. And don't underestimate the benefit of using journaling. If you journal just those 4 things, you'll be able to identify the right levels of cannabis to use and actually how to get the maximum benefit out of it, both from an efficacy standpoint and also from a cost-effective standpoint. What can I use? What kind of guides do I have to help me with my journaling journey? Well, MMTC puts out what they call a medical marijuana patient journey. Here's a link to it down here. And it gives you a lot of information on how to use cannabis here in Florida. It also has that dosing journal that you saw a little bit earlier for you. Please feel free to access this. This is really, really critical to being able to help you understand your journey and being able to move forward. Now, I also want to point out a couple of other things. Other support resources. We have a YouTube channel, which you could be accessing now to look at this video and being able to not only look at how to use medical cannabis from a individualized standpoint, but also follow that whole journey on what methods of administration are. And then next week, we're going to be talking about the different products that can be used for different range of conditions, talking about cooking with it, And also we have a very special webinar coming up for veterans. I want to thank you very much for joining us. And again, I do want to point out, if anyone wants to get a medical marijuana card, please use Marijuana Treatment Clinics of Florida. And if you're looking for a dispensary to take a look at, I recommend taking a look at AIR. They do a great job of providing products that have high terpene profiles and are basically some of the finest products in the industry. Thank you very much for joining me, and we hope you join us for next week's webinar, which is how to address your relief for various medical conditions.